How do we make a diagnosis for this condition? I guess diagnosis is an exaggeration at the moment because we don't have any blood test or any imaging finding that tells us that we can definitively make a diagnosis. It's a diagnosis of exclusion. It's a hypothesis more than anything else. And clinically, the condition that would to give us some confidence to tell us that the person who's seeking care might have this condition would be average age 50 years of age, as we mentioned earlier. There'll be an equal restriction of active and passive external rotation of the shoulder, the affected shoulder. If a paper we published about 20 years ago, almost 20 years ago now, suggested that one of the ways that we could establish that was running a tape measure from the umbilicus or the belly button to the ulnar styloid process and measure that side to side. So I'm not so interested in the actual number, but I'm interested in the ratio. So for example, if on the side of the painful restricted shoulder, it's 20 centimeters and the other side is 40 centimeters, putting 20 over 40 gives us a 50% restriction in movement. And that would be the minimum that we would expect in this condition. If we don't have that, I would be very cautious about making a hypothesis that this person has a frozen shoulder. There are other clinical tests such as passive abduction of the shoulder. You probably wouldn't get much more than about 30 degrees in a contracted capsule. You certainly wouldn't get to the 90 degrees as depicted on the picture on the slide. And the other feature that is relevant for me to increase the likelihood of supporting this hypothesis would be an X-ray. It's the only condition of the shoulder where the shoulder is stiff, but the X-ray is normal. Every other condition involving shoulder stiffness, such as arthritis, such as an osteosarcoma, such as avascular necrosis, a lock dislocation, severe, as I mentioned, severe arthritis and rotator cuff arthropathy, the X-ray won't be normal, as we can see in these X-ray presentations of people who've the X-rays of people who've been referred to our frozen shoulder service who clearly don't have a frozen shoulder, except for the one on the left of the screen. So that's also, it doesn't confirm a diagnosis, but it helps increase the likelihood of making a diagnosis. And I would never say to a patient, you have got a frozen shoulder, but I would say that on the basis of our conversation, on the basis of the clinical examination, it is likely you have a condition called frozen shoulder. This is what it means. These are the different treatment options you could consider, including a wait and watch approach. There's no definitive necessity to intervene with this condition, but you'd want to be presenting the different treatments at the different timeframes and with their potential risk, their potential harms and anticipated outcomes, so that the patient can decide what's the best treatment for them to consider at this particular point